Go.
Hi, my name is Morgan Cups. I'm doing the head to toe. Here's my ID badge. And then this is Morgan Pesnell, another nursing student. Do you consent to the head to toe video?
Yes, I do.
And then here's a 360 of the room. All right, so to start my head to toe assessment, I would enter the room and introduce myself to the patient. So hi, I'm Morgan. I'm going to be your student nurse today. We're going to be doing a head to toe assessment. Can you tell me your name and date of birth?
Morgan Pesnell, 4/10/2000.
And those are the two patient identifiers, and then I provide privacy before starting the assessment. So starting the assessment, I can see that she is sitting comfortably up in the chair. She appears well groomed and has proper hygiene. She also has an appropriate mood for the circumstances. And now I'm going to test your level of consciousness. So I'm going to ask you 3 questions. So around what time is it?
11 a.m.
What season is it?
Fall.
And what are we doing and where are we?
We're at home and we're doing a head to toe assessment.
So she answered all 3 questions correctly. So she is alert and oriented ×3, and her speech was clear and understandable. So after assessing that, are you experiencing any pain today?
No, I'm not.
If she was, I'd ask her to rate it on a scale from 1 to 10. But in this case scenario, she is not. And now I'm going to assess her vitals. So I'm going to start by taking her pulse and assessing her respiratory level. So I'm going to use this and get your radial pulse. Okay, so her pulse is around 76 beats per minute, and I was also, which is normal and within range, and is also elastic and strong. I was also assessing her respiratory rate at the same time, and she had around 14 breaths per minute, and the depth was normal, and so was the pattern. Next, I'm going to assess her blood pressure. So what does your blood pressure normally run at?
120/80.
All right. I'm going to have you hold that for me. Thank you. Her blood pressure was 110/70, which is within normal range. And so there's nothing further that we have to do to evaluate that. After assessing her respiratory or her blood pressure, I'm going to move on to her facial symmetry. So can I have you look at me? Her face is symmetrical on both sides and there is no drooping. And now I'm going to have you smile for me and puff out your cheeks. And her face moves symmetrically on both sides and there is no drooping with movement, which is appropriate. Next, I'm going to assess Perla. So I'm going to start by looking at her pupils and making sure that they are equal and round. So her pupils are around 7 millimeters on both sides. And now I'm going to assess how they react to direct and indirect light. So I'm going to have you look into the light. And her pupils constricted. And then I'm going to do indirect light. So shining on one side and looking at the other. And they also reacted correctly. Now I'm going to check for accommodation, so look at the top of my pen light, and I'm going to move it closer towards you. Her eyes had appropriate reaction to accommodation, and therefore her Perla exam was normal. Next, I'm going to assess her arms bilaterally, so can I have you put your arms out for me? So looking at her arms, they are a tan beige color and they are symmetrical. There are a few primary lesions, such as freckles, which are all about the size of a pinhead. And they're all a darker brown color and they're spread out sporadically throughout both arms. Now I'm going to assess for edema. And I'm going to move your arm like this. Any pain?
No.
And now I'm going to assess the other one. Any pain?
No.
So she had no pain with movement or tenderness. There was no edema, and the temperature of her arms was normal. After assessing her arms, I'm going to move on to her chest wall. So looking at her chest, you can see that it is symmetrical on both sides. It is a tan beige color, and there are a few primary lesions such as freckles. And it is, her chest is non-barreled. So after looking at that, I'm going to assess the lung sounds. So I'm starting at the top of the trachea. And this is where you hear bronchial. In the middle by the sternum on the outside is bronchial vesicular. And then at the bottom of the lungs is vesicular sound. So those are all within normal range. And next I'm going to assess the 10 lung sounds on the front and the back. So I'm going to start up here, and each time I move my stethoscope, can I have you take a deep breath for me? All right, now can I have you turn around for me? And same thing, every time I move my stethoscope, take a deep breath. All right, so her lungs sounded normal. There was no bronchi or wheezing, which is good. The breath sounds were also normal. Next, I'm going to assess the 5 heart sounds, or the 5 heart locations. And I'm looking for S1 and S2 sounds, and also if there are any murmurs. So I'm starting up on the right side on the second intercostal, which is the aortic. Second intercostal on the left side, which is pulmonic. Third intercostal closer to the sternum is Erb's point. Fourth intercostal is tricuspid. And then fifth intercostal is mitral. All of her heart sounds sounded normal. There were S1 sounds at the apex of the heart and S2 at the base. There were no heart murmurs, and if there were, I would have heard them at Erb's point. So after assessing her chest wall and her heart sounds, I'm going to have you move over to the couch, and I'm going to assess your abdomen. Normally, if you were in the hospital setting, I would have a towel placed across her chest and her lower body to ensure privacy, but it's not necessary because she is covered. And now I'm going to inspect the abdomen. So it is symmetrical on both sides. There is no distension or curvature, and there are a few primary lesions, and then she also does have her belly button pierced, but that is not causing any issues at this time. So are you experiencing any pain today in your abdomen?
No.
She is not, but if she was, I would start in the quadrant right after that and end in the quadrant with pain. So I'm going to start by auscultating the abdomen in the lower right quadrant. So I heard around 13 to 14 bowel sounds, which is within the normal range per minute. Next, I'm going to assess the abdomen for any tenderness. So I'm going to start in the lower right quadrant again, and let me know if there's any pain. Any pain?
No.
Any pain?
No.
Any pain?
No.
Any pain?
No.
All right, so there was no pain within her abdomen, so that she had a normal abdominal assessment. And now I'm going to have you go sit back in the chair, and I'm going to assess your legs. So looking at her legs bilaterally next to each other, they are symmetrical. They are a beige color, and there are a few primary lesions such as freckles, which are all about the size of a pinhead and brown. And then she does have a few secondary lesions, which are bruises that are right below the knee and then up on the upper side of her left thigh, which I'm guessing is due to falling or some sort of incident.
Yes, I fell.
Okay. And then her hair distribution along her legs is normal and there's no venous patterning. So I'm going to assess your legs for edema now. So I'm going to palpate your legs. And I'm going to move your leg up like this. Any pain?
Nope.
All right. I'm gonna move your leg. Any pain?
No.
All right, there was no edema or pitting moving down her legs. Her legs did get cooler as I moved towards the feet, which is normal, and she had no pain within her joints. After evaluating her legs for any edema, do you have any numbness or tingling in your feet or extremities?
No.
She does not, and so now I'm going to move on to assess her reflexes. So I'm going to have you pull your feet towards you. Good, and now push away. Her reflexes were normal, and they were both equal on each side. And now I'm going to check for any skin breakdown on her feet. So I'm going to look in the back of her heels and in between her toes. And there is no skin breakdown at this time, which is good. And after assessing that, I'm going to check her pulses on her feet. So I'm starting with the dorsal pedis pulse, which is on the top of the foot. And it is a somewhat strong pulse, and it's a grade 2. And then I'm going to check her posterior tibialis pulse. And this pulse is stronger, and it is a grade 2 as well. After evaluating her pulses on her feet, next I'm going to see if there are any interventions that she has, such as an IV, a catheter, or a Foley, and she does not have any of those, so that would conclude my head-to-toe assessment. I would put the bed in the lowest position, both side rails up, call light within reach, and make sure the patient doesn't need anything else, and then I would leave the room and document all of my findings. Thank you!